How do you balance clinical work, teaching, personal life without burning out?
Teaching can be almost like a release from that because you're still doing your job, but you're just doing something different. And I love that. I think the balance is just fantastic.
How are things different now to when you were a student? When you're now, in a post-COVID world, you're teaching these students, or the tutor who goes and checks the cavity prep, then the matrix, and all the different stages of every operative procedure. Are they doing less than when you were a student, or is it about the same, or like what has changed?
I do think now the curriculum's been changed multiple times, and I do think that they are gaining access where they're feeling confident. I'd say, and a lot of my colleagues also agree with me, we were actually teaching chairside. We weren't supervising, we were teaching. And there's a big difference between teaching and supervising. And I think now we've gone back to supervising, which is fantastic. It means that we are literally watching them do an ID block.
What is, on the flip side, the most rewarding thing about what you do?
Sometimes you have the students and they're like, thank you so much for teaching me that. I understand it so much better. Just little comments like that. For me, they're so incredibly powerful.
Have you ever thought about a career in dental education? A bit of teaching on the side, quite commonly attached to a university or teaching hospital, and to help inspire and educate the next generation of dentists. When you think of all the different things that are possible in dentistry in terms of the different ways you can take your career, honestly, I want to emphasize again that we are in a wonderful career. You can mold it in so many different ways. You can go into medico-legal, you can go into forensics, you can just do dentures and that's all you do, and you can just do kids and that is it. You limit yourself to any area of dentistry that you like, and you don't even have to specialize in that area to limit yourself to that area. And so in this episode, we'll deep dive into a career in dental education with our guest, Dr. Reema Hussain. Reema's a general dentist, but she has a part-time role in a teaching hospital on the clinics with undergrads. And this is quite a popular route to consider for general dentists. It's a great way, as you'll hear from Reema, to break up the week. Do something different, do something rewarding, change the environment. And if you have that spark for teaching inside you, then it will energize you. Now, if you don't have the patience or don't enjoy teaching, it will of course suck the energy out of you. I'm sure we can all remember a few tutors at dental school that probably sat in that camp and you wondered why they were teaching in the first place. And so this episode will help you decide, which camp are you? Are you someone who would fit well into a career in dental education? And how do you get yourself into an establishment such as a dental school? You'll hear all about Reema's journey and advice when it comes to dental education, but just want to reflect on my own journey. I've actually always been interested in the idea of teaching. I absolutely love it. Now, some people, to stand up in front of a class and do what is kind of like a form of public speaking, they hate the idea of that. But I really enjoy sharing ideas, presenting ideas. And when that special light bulb moment goes off on a student, that is a very satisfying feeling. Now, one of my strengths, I have 5 strengths. We all have 5 key strengths. This is something I got from the book Strengths Finder 2.0. I keep banging on about this book. It's by Tom Rath, and it's like a little quiz you do. And I've got these 5 strengths. One of them, my top strength, is learner. Okay, so I really enjoy learning. And if you look at the taxonomy of learning, the highest form of learning is when you're teaching and sharing. So it's probably why I gravitated toward this from very early on in my career. Even as a dental student, I used to share my notes and do presentations for my colleagues. And being just 1 year out of dental school, I did a postgraduate certificate in dental education. Not that I thought you need that to become a better educator, but I wanted the letters after my name to keep my avenues and options open. In case I did want to be a formal trainer or a teacher at dental school in the future, it would probably help my chances, because I just knew that I wanted teaching to be a part of my own dental career. Now, as you all know, I've kind of molded it in my own weird and wonderful way, starting accidentally with this podcast. So it's a little bit unconventional, but I just want to share with you that if you have that calling inside you, if you have that joy from sharing ideas and teaching, I hope that you take away some inspiration from this episode. This is an interference cast, our non-clinical arm of the podcast. There will be CPD for this one, so listen all the way to the end, and I'll catch you in the outro.
To Reema Hussain, welcome to the Protrusive podcast. Nice to join us. You've got your 3-year-old to bed, I've got my boys to bed, and this is kind of like how we make time for grown-up things like this. And thank you so much for coming on, talking about something like I'm sure you get quizzed on all the time when you're amongst your sort of dental colleagues. They must have so many of the same questions. So let's find out about a career in dental education. We have to go all the way back and learn about you, Reema. Tell us about your journey.
So I graduated in 2016, and since then I did my DFT, my training, and I've been in general practice since. And yeah, so I always wanted to do teaching. I knew that from quite an early age, but I didn't know it was going to come quite so early for me. I thought away a couple of years. But yeah, I started teaching in the local dental hospital, which I really, really enjoy. I started doing that in 2019. And I've been there ever since. And I think it was September 2019, that's when I started teaching undergraduate students.
How do you even get into that? So, okay, before we unpack how do you get into that, you said you're into teaching, okay, and me too, right? And so I, at one stage in my life, I said, "Oh, I quite fancy being a teacher." I feel like when you're a kid at school and like you see these role models, right? Your teachers are your role models, and so many people actually, when you go around the class, so many people end up saying they want to be teachers. I don't know if you remember having the similar experience when we were kids. People say, "Yeah, I want to be a teacher," because their role models are their teachers, right? And then when you start doing your GCSEs, A levels, and you're thinking of uni, then that kind of like drops a bit for a lot of people. For a lot of people, they do English and then go teaching, or science-based subjects, then they go into teaching. In dentistry, it's a very vocational thing. But the best thing about dentistry is that you can niche into any area, including having some, breaking up the week in some way with education. So, how did you know that you wanted education to be part of it? What are the signs that you had that okay, you're into teaching?
And it's gonna sound like such a cliche, but I honestly fell into it. I was in about year 10, and one of my mum's friends reached out and was like, "Oh, can you teach our sons this, that, this?" And I was like, "Yeah, okay, cool. Bit of extra money. At that age, you're just finding your feet. So yeah, sure. I'll do it." And then it kind of all stemmed from there. I was like, "Oh, actually, this is quite good. I'm really enjoying this." And they kind of recommended me to some of their friends, and then by that time, I had like about 12 to 13 students. And I was like, okay, I literally just fell into it and just carried
You
it
had a
on.
good business when you were like 15, 16 years old.
Honestly, the tutoring rates now is just insane. If anyone is looking for a side hustle, that's the way to go. And so I really enjoyed doing it. And I did that up until my final year at dental school. And I just knew that, look, I've done 10 years of teaching. I know this is what I want to do. I don't know if I'm good enough. I don't know if I will be any good at, applying it, but I just thought this is what I enjoy. Um, so that's literally where it came from and why I knew that this is something I want to do.
Mhm. In a similar way, I kind of fell into it in a bit in a way as well, where I was asked, but both during school, A levels and stuff, where I just had that affinity to explain. I know you kind of learn more when you're explaining something to someone else, right? So it's like taxonomy of learning. And then when I came to dent school first year, my buddy Eric, he flunks first year, he fails, and then my parents say that hey, we're going to Switzerland for a big family holiday. They're like cousins and everything, and then I had a choice to make. Eric was like, because I was like, I was getting some of the highest marks in the year. So Eric goes to me, okay, can you please help me pass first year? Like stay behind the summer, tutor me so I can pass my first year, right? Like but looking back at it now, like first year is a bit of a dud away. It was like, we made a big deal out of it at the time, right? But he
We were
genuinely needed help.
petrified.
And
We were petrified. I remember
of
that. I remember
course,
that so well.
exactly. Like we think that A levels are hard, and then you go into dental school. Oh my god, first year exams, and at the time it's like a huge fear, not knowing what lies further ahead, obviously. But then Eric was like, okay, can you help me pass? And my parents like, do you want to come to Switzerland? Anyway, at that time I picked to stay behind, and I helped Eric because not because I'm a good guy, a little bit of that, but because he said that he'll take me to Japan and Korea in return.
Oh,
So so I
wow.
stayed behind. He passed his first year, right? So it was all worth it. I was so happy when he got his results, right? And then a few years later, he did actually come true to his word. He took me to Japan and Korea. So interesting story there, right?
I
And
love
then when
that.
I qualified, I in my first year as a DF, I did a postgraduate certificate in dental education.
Mm,
Have you done that?
I have. And it's so eye-opening, isn't it?
It was eye opening. The most eye opening thing, like it was also a lot of wishy-washy stuff that it's not going to help you be a better educator. It's like
Yeah.
learning about the history of education and all that kind of stuff and the philosophies and that kind of stuff. Whereas the only way you're going to get better at teaching is actually teaching. It's a bit like endo. If you want to get good at endo, you don't do an endo MSc and read about all the different bacteria and all the different file manufacturers' dimensions. You actually get good at doing endo by doing endo.
I totally agree. And that was such a foreign concept to me, Dad, where, you do science and you learn about science. And this is all, as you said, wishy-washy. It was all like, okay, this is one theory, but then this contradicts that. And I was like, oh, okay, wow. I've never known something to be so not like you can talk about it for ages and still not quite get the concept, if that makes any sense. But I did. There was quite a few things I took away from it, and I was like, oh wow, I can apply this. But also, what I found really interesting is I was like, we're actually already doing this, but to actually understand the theory behind it, which I found really interesting. That we're already doing this, but this is why we're doing it. So I found that really interesting. Things like, for example, learning objectives. Why do we have learning objectives? And actually learning that, I was like, okay, right, that's interesting. So yeah, there was parts, yeah, the assignments, yeah, that was hard, but yeah, I did enjoy it. I did enjoy it, and I did
Where did you
that.
do yours?
I did mine at Things as well. Yeah, did I think.
Okay, you just stay in one place, like you're
I
literally home
do. I
country.
know. I know. I think all the staff that when I was in undergrad, they should remember me. I don't know if it's a good thing or a bad thing. But yeah, it's, long licking.
Good, 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 good. Well, yeah, I get that. It's a comfortable place. It's a cool place. For me, I did it at Bedfordshire, University of
Wow.
Bedfordshire, and the thing I learned the most is that the role of an educator is not to transfer my brain into someone else's. It's not that. It was really to inspire a person to figure it out themselves. Because when someone has that spark inside them to genuinely learn, when you can give someone that spark, nothing can stop them. They are unstoppable. They will learn and they will master. If you don't create that spark, it's a bit like as parents, right? We want the best for our children. But some kids have a spark. They have a real spark for learning, and other kids don't, right? And it's our job as educators to start that spark in our students so that they can go ahead and carry the journey forward rather than trying to just give them everything, every piece of knowledge. And that was the biggest
100%.
thing I took away.
That's brilliant. Yeah, that's really, really good. You just reminded me that that was another aspect which sounds great. I would definitely recommend it to anyone, even if they're not interested in teaching. I think it's just eye-opening and just so different to doing a dental degree. I was like, oh, this is great.
Do
Yeah,
you
I'm
think
enjoying it.
do you think you needed it? Do you think like so how did you actually fall into being a tutor in the clinics? And tell us more about like, did you start like teaching like fourth year dental students, or did they start like in a different setting and then you kind of get promoted? How does it work?
Mhm. So honestly, Jazz, what happened is I was 2 years out. One of the years was my foundation training, and one of my friends, she applied for an oral surgery postdoc thing, and we've graduated in the same year. And I thought, oh, that's interesting. She got an interview. So I thought, you put two and two together and think, okay, well, we've graduated at the same time. Maybe I'll get an interview if I apply. And the post came up on BDJ Jobs, which they do come out every so often, maybe every 6 months or so. And yeah, I applied. So the window is really short. Put a whole application through, like a personal statement, things like that. So it's quite a long-winded application. But I got an interview, and I'm not gonna lie, it was one of the hardest interviews. I do think a lot of it was because of my age. Naturally, I expected those questions to come up. But I think they must have seen compassion in me. I think they must have seen something because some of the questions were, you're not as experienced as a lot of our tutors, and we were all at dental school. We all had, people who are close to retirement age and things like that. And I was like, I totally agree. I don't have experience, but what I do have is I have knowledge, and I have to keep my knowledge up to date. And I'm really, really passionate about teaching and nurturing these students. I want to try and give back to, what I felt would be a good clinical tutor for me. So that's what I really wanted to do. So I think I took a chance on this. Um, yeah, I've been there ever since, and I really enjoy it.
Wow. So you were in like teaching extractions basically.
Um, so that was my friend applied for the oral surgery. I applied for restorative, and at the time they asked me, they were like, "Look, which discipline do you feel comfortable teaching?" And this is talking from a general dentist point of view. I was like, "Well, generally con, that's a referred to conservative dentistry, is what I feel comfortable teaching." And they did ask me. They said, "Would you be comfortable teaching final years?" And I said, "Well, maybe start off with the third or the fourth years." But I think that I think they hired me maybe 2 or 3 months later, thrown straight in the deep end, Dev, like straight in the deep end, right? This is your group of students, there you go, teach.
Mhm.
And I like that. I think that works for me. I know it's not for everyone, but I was always used to that at Keynes. I was used to being thrown at the deep end, and I liked it. I flourish in that high pressure, plus, we don't know what we're doing, but okay, we'll just roll with it. And I like that. So it works for me. Yeah. I always think there's two types of people. I think there's people who love it and are really passionate about it. And then there's people who might like teaching, but they just don't like the red tape involved. We've got to get through these hoops and hurdles to get through this. And I do hear that, and there's a lot of that in hospital. But yeah, I like it.
Excellent. And then so with your students, on your first day in the clinic, like you said yourself when you were having the conversation with those guys and they were like, "Hey, do you want to teach final year?" You must have had a degree of imposter syndrome because you said, "No, no, no, let's start a little bit younger," kind of thing. So you must have had some doubts, right? About like, can I do this? Can I not? Am I too young? But I just want to say that probably you didn't realize it at the time. But when you are an absolute beginner, which is what students are, right? Absolute beginner, the master will find it difficult to relate to the absolute beginner. The master, who's 20 plus years, they've got an MSc in restorative dentistry from Eastman or whatever, and they're talking about precision, and the student doesn't know the correct end of the burr. Like, they're so far apart that, you need to, that bridge is too big. So I think that was your strength, that you were so much more relatable. But that's just me and my thought process. Did you feel that became a strength for you?
I absolutely agree, and I didn't realize that at the time of the interview. And I did say to them, I said, look, one of the questions was, a lot of these students are going to be significantly older than you, more experienced than you, not just in dentistry, but they will have the undergraduate degree. How do you think you'll relate to that? And what I said to them is, I feel maybe because of my age, they might feel more, they feel that they could approach me more. Maybe they feel like they'd feel comfortable to ask me questions. They might not ask maybe a much more experienced tutor. And touch wood, that's how it was conveyed over the clinic. I was just saying that at the time, not sure how that was going to pan out, but it did actually appear that way. A lot of the students would feel comfortable requesting me, and it sometimes would come to, I'm really sorry, is it okay to offer another tutor who prompts it? So that's conveyed, and I think honestly it's probably because of my age and the fact that potentially they maybe saw me as the nice tutor. I don't know. Don't get me wrong, we always have to be firm, of course. But yeah, I just want to try and create a nurturing environment because we were all there. We all did our first extraction, our first composite. I remember being really, really scared and really nervous. And although we might not remember all the ins and outs of the procedure, I just want to try and provide a nice nurturing environment for them as well. So yeah.
How are things different now to when you were a student? Like when you're now, in a post-COVID world, you're teaching these students, you're the tutor who goes and checks the cavity prep, then the matrix, and all the different stages of every operative procedure. Are they doing less than when you were a student, or is it about the same, or like what has changed?
I'd say definitely especially post-COVID. Post-COVID was pretty hard. It's almost like every year went a step back. So they were doing things that they would have done later on, like a whole year later on. I do think now the curriculum's been changed multiple times, and I do think that they are gaining access where they're feeling confident. I'd say, and a lot of my colleagues also agree with me, we were actually teaching chairside. We weren't supervising, we were teaching. And there's a big difference between teaching and supervising. And I think now we've gone back to supervising, which is fantastic. It means that we are literally watching them do an ID block, watching them do a buckle filtration, as opposed to literally chairside teaching. You can imagine which one takes longer. So that's fantastic. I think that's happened, I'd say maybe in the last 2 odd years or so. But yeah, I do think the dental foundation training really was going to prepare them for associate life or practice life and things like that. But there is a big drive in final year to see a lot of patients. I'm not as involved with final years, I'm mainly with BDS4, but they are seeing many more patients now in BDS4, which is good.
Like the number of patients they see in a day was similar to what you were seeing, or more or less? Now, I mean, now that is a good few years after COVID now, like, is
Yeah,
it like looking okay, or are we generally concerned that the next generation are doing way less than we were?
they are now.
And
They're doing now.
I mean, don't get me wrong, we didn't do much, right? Like, let's admit it. I did like, okay, I did a lot of root canals, but I must have done like 7 crowns or something, right? So like, not the crazy amount of things.
Yeah. No, I hear you, and I think now they don't want to have quotas because it gets the students out, and I totally understand that. So yeah, I think they're on par now. But yeah, it did take some time. And I think I was only 2016, but things started to change quite quickly after I graduated. There's a lot of teachers that said, "Oh, your year was the last year that things were, supervised and things were going just, routine how it had been for years and years." But yeah, I think a lot of it was down to COVID.
Here's something I'd love your take on. I get lots of students DMing me on Instagram, and like they were like, "Oh, I've been following your podcast for 4 years," and they watch all the YouTube videos, and they know a lot. Like they've seen all the episodes about immediate dentin sealing, which I had no idea when I was a student. They've got YouTube, right, which is like rich in anatomy building, and that stuff wasn't around when I was a student, right? I would have loved that. They've got so much information. They've got to be careful. It's information overload. But do you think that the exposure and the sort of application or the prior knowledge of students is maybe better than what we had because of the internet? Or do you think it's actually had the opposite effect and maybe it's made everyone anxious? And I don't know. You tell me.
I think it's been great. I honestly think the caliber, the types of students that are coming are really different. They almost have their end goal in mind. They know what they're going to do when they qualify, which I think is fantastic. I don't think a lot of us had any clue. We were literally just getting through. We didn't know about anything about the NHS UBA system. We didn't know anything about, this is what we're going to do postgraduate wise. Some of the graduates, don't get me wrong, they had a rough idea, but no one was like, I'm going to do this. So yeah, they come in and they know what they want and they know what they want to do.
Do you think the social media and the exposure and the fact that they can YouTube search for, and now AI as well, they can get answer at their fingertips? And like, let's say before you did your first or second cram prep, you'd be like opening Schillingbergs back in the day, or trying to revise and stuff. Now they can just watch a video of loads of dentists under microscope on YouTube doing a prep, or talking through it, or just going on reels and looking, okay, here's how to do a cram prep in 45 minutes or whatever, like even 5 minutes. They have these videos, right? And so they can see the quick occlusal reduction, and like even we make some reels which are super educational in 60 seconds. And so now they're seeing this stuff, and maybe they're going to be better equipped or have a better understanding. Do you feel that's happening?
Yes, I definitely think it's happening. I think the one issue we have is, say for example, yourself or me, we went and looked at these videos because we can do the basic crown prep. It's different. What we can take, what we want from it. Whereas these students, a lot of them haven't done crowns, or they've done one crown on, phantom head. So sometimes it does worry me that they almost kind of run before they walk, where they're learning, oh, okay, we're going to do a nice margin, or we're going to do vertical and things like that. But actually, you don't know the basics. Does that make sense? And that does sometimes concern me.
Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats, and dentists helping dentists. And really what I wanted to do is create a really supportive environment that's not like the environment we have on Facebook, and is built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads, and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you do make an account on Android, iOS. If you make it on the website, you get access to the free trial and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description. And thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode.
Most of the time, a lot of the students, and I do sometimes direct them to your podcast, by the way. But I do sometimes say, look, have a read around, do it in your kind of free time. But when you're revising, just stick to the principles you've learned at the university, because that's what's going to get you used to doing a restoration or a crown, and that just will build the fundamentals and the basics. And that's what we're trying to do. We're trying to aim to get them to be base beginners. But occasionally, I might, be like, okay, I've learned this at a course and just teach them this on the clinic. But for a lot of the time, it'll be a student that has shown me they can do a class 2 cavity in a reasonable period of time. And that's how we're like, let's just push them a little bit more. Let's just show them about layering. Let's show them using these composite brushes and things like that. But it'll be the ones that have shown me that they've got good foundation. There have been occasions where they're like, oh, should we talk about this and should we talk about that? And I'm like, let's just, step back a bit and let's just go back to basics. And it's just all student dependent, if I'm being completely honest. But yeah, they know what they want to do. It's amazing. It's good to see.
That's why, yeah, I think that's the social media effect and seeing it. But I think the danger is that it's almost like monkey see, monkey do. They saw something online, they think, oh, I can do that, but they haven't understood why to do that or when to do that, right? And I think that's your role, to just guide them and be the Sherpa and actually make sure that they get safely. And don't get distracted by what they're seeing on social. It's about they still need you to, they can't just get the dental degree on YouTube. They need to learn it. I'll give you a good example. I had one of our followers message me a little bit upset. He's like, a young associate at the practice. He made a dog's dinner of an extraction, and then my friend goes in and says, okay, let me help you, kind of thing. And he said, look, what happened? He's like, Jazz Gulati says he sections most of the molars when he extracts them, so I thought I'd give it a go, right? Not understanding that if a tooth is conical, you don't need to section. You see what I mean? Like, you got to be.
This is one thing, and they've applied that to everything, because Dan's done it. I can do it as well. Yeah, no,
it needs to be structured, and I think that's the dangers. And it's important to discuss about the dangers of all this wonderful stuff there as well. At the point of application, even dentists, like, they go on courses, well-intentioned, they pay lots of money. Then when it comes to the application on the cases, they struggle. That's the tricky bit, right? Learning and actually applying it is two different things. And so when you're a student, where you actually have, like, your mind's everywhere, you haven't even grasped you haven't connected the dots yet, that's where your power comes in, and your focus and your role is to really guide them and hold their hand. And I like what you said about bringing them back to basics. There was a stage where I was doing my DF training, and I wanted to do like 3/4 gold crown prep, and I hadn't done many, like, obviously gold crown preps anyway. And my pros tutor at the time, he looked at me saying, Jazz, listen, let's just keep it basics. Don't, you're not ready. Your hand's not there yet. That night, I was really offended. That evening, I was reflecting. I was like, oh, that was a really harsh thing he said to me. But now, I was like, you know what? He's probably right. And my hands weren't there. I just, maybe I like the idea of doing it, but my hands weren't there. So maybe let's start with the full on late, and then maybe go for the partial in the future. And I think any students who are listening to this, don't be disheartened when your tutor says something that is probably, you feel as though it's not fueling your growth, but actually it's actually guiding it. It can't be fueled because the foundations aren't there yet.
I totally agree, Jazz. And I think that's something, as a student, you don't understand. You're literally raring to go. And I try to remember this. I want to do that. I'm doing that. I want to get that done. And sometimes it's the tutor setting you back, and realizing the implications of this difficult subgingival clock too. And you just don't have that. You don't have that ability as a student. And I think now, looking on the flip side, you're like, that's what that tutor. Well, that's why they stopped me doing that. And it's great. Hindsight's a great thing, isn't it? But yeah, at the time, you're like, I want to do it.
Absolutely, no, we will win there. So, in terms of getting into these education roles, you mentioned like BDJ jobs, and these jobs often come around. I don't know what it's like outside London, whatnot, or around the world. It may be that I'm a big believer that if you generally want to teach at a local dental hospital, dental school, pick up the phone, call the end school department and say, "Hey, I'm a general dentist. I'm interested in teaching. I've got availability on Wednesdays and Mondays. Are you hiring?"
Yeah.
If not, I'd like to put my name in the hat, because if you wait around for that job listing to come up, it may never come up. And sometimes these are internal hires and who you know and that kind of stuff. So, do you think that's fair advice?
I think that's brilliant. I think that's brilliant advice. For example, if I'm always trying to get my husband to join, and that's the thing, because he got away in this for me. So it is, as you said, who you know. But naturally, and this goes for associate job. When you recommend someone, they naturally are more likely to go for that person, whether they know them or not. They trust you, and they would trust that person. I think there's just an element of familiarity with that. So I just think that's a brilliant way. You cut through all that application process, going through everything. I think,
Is it the same for associate positions? If anyone's looking for an associate
yeah,
position, just
yeah,
because the practice that you want to work in 2 miles away it hasn't got a big sign outside the practice saying hiring for an associate, doesn't mean you can't go in, drop your CV, say hello to the practice manager and the principal, and shake their hand. And that's I've got a few jobs like that in the past, actually. And so you just need to get yourself known and be like, okay, this person is bringing a nice vibe to practice, and just by chance, 1 month later, an associate leaves, and like, oh, they don't want to have to go through a hiring process. Who's that nice guy that came in that dropped his CV? Let's give him a call. Okay, and that's kind of how it works out.
yes, no, I certainly agree. And I think with teaching, you know very quickly if it's not for you. So there's quite a few. This doesn't happen in a large area. So we have a lot of tutors who come 6 months, they're gone. And they realize quite early on it's not for them. So we have quite a few of those, and then we have the ones that just stay, and they stay there for years and years and years, which is great. So yeah, I mean, like you just said, if there's someone who just goes after 6 months, then naturally a new position opens. Takes time to fill them in.
Mhm.
So if you've got some ready-made person, great. But yeah, connections, knowing who is in the dental hospitals and who's working where. It's always the first question I get asked: how did you apply for that job? How did you get in? And people are quite surprised when I tell them, "Oh yeah, the BDJ Jobs." Um,
Mhm.
but it's also who you know. So yeah.
Those people, those tutors that teach for 6 months and then they leave,
Mhm.
what traits have you identified, or what reasons have you identified? Like, why is it that person A will stick around and they'll love it and they'll stick around, whereas there's a whole host of people who will just leave after 6 months? Have you noticed any patterns in terms of, are these tutors in a certain phase of life, or were they expecting one thing and they found another thing? What advice could you give someone? Because someone here could be inspired by, oh, you know what, I quite fancy teaching, and then they go, is that, whoa, this is not what I signed up for. I'm not going to stick past 6 months. So, what's the real advice you want to give, to perhaps even give some real reasons of why people left? What were the reasons they gave?
Yeah. So a lot of the time, like I said, it's expectations. This is the expectation they think they're going to come in with, and it's not quite met their expectations. Um, and a lot of the time, I think one of the biggest misconceptions is that it's quite a chilled or cushy job. It can be, but most of the time you're working pretty hard. You're in charge of, 6 to 8, sometimes 10 students. They're all doing quite, innovative work, and they are, they need a lot of guidance. They need a lot of support and clinical knowledge. A lot of them are just doing the first, second, third restoration. So, I think it's just for a lot of the tutors who leave shortly after, it's just the expectations not managed. Maybe the workload is more than what they expected. Seminar preparation, so we do seminars every week as well. That takes time. So
Mm-hmm.
initially when I first started, I spent a lot of time on the weekends preparing seminars, because these students, they know a lot, and they're going to question you. So we're going to make sure you're up to date on the things. So, but as you move through the years, you're there for longer and longer. You get used to that. You get used to it. It's almost the same seminars. They just updated every so often. You get more efficient, quicker at doing it. You spend less of your weekend. Well, weekend, I think, a few hours. Roughly. So you don't need to spend as much time preparing, which is nice. On the subject, sorry, I know I'm bouncing back to AI, but actually, sometimes I type in some of the tutorial questions that they ask in the students into AI just because I want to see what comes up, and a lot of it is wrong. So yeah, that's a bit worrying. Some of it's right, don't get me wrong. But yeah, some of it is actually fundamentally wrong.
Give us an example that you might remember.
So it was talking about direct restoration, and it was talking about using ceramic as a direct restoration, stuff like that. And it was talking about bonding ceramic. No, sorry. God, I can't even remember. It's so bizarre, Jazz. I can't even remember what it's saying. And then I think I put an X-ray on there. I'll send you what it says. And I think it got the tooth location incorrect, and it was causing cervical burnout, caries, and things like that. So AI is great, but I think it's great for a dentist, someone who's got clinical knowledge and has the experience.
Clinical judgment and experience to call
Exactly.
BS. Like you could easily look at that as like that. No, whereas a
Exactly.
layperson would be like, oh, okay.
And the student would be like, hey, that's caries, yeah, right? So yeah, I always tell them, please don't use ChatGPT. I will find out. I will know. So please don't do it. So yeah, it's interesting to know what else is out there.
ChatGPT will make up like names of authors and papers. I've done it before, where it will be like, check out this paper by Manier and this author. And I was like, wait, I've never heard of that author. Tell me more about that author. It was like, oh, I'm afraid I can't find this author. Like it'll do that. Interesting. I don't know if you saw if you're on the app or not, but we created a Protrusive AI. It's like a GPT. It's in beta, and what it's going to be basically is the problem with ChatGPT is it gets all its information from like Reddit and the wide web, which is full of gibberish, right? So what we've done is we've packed every single Protrusive transcript, everything we teach in our courses, everything like together. So it's like verified spoken word that we've said that is like real dentist talk, kind of like feeding it lots of textbooks. But we didn't put textbooks because of copyright stuff. So we just put all our episodes. And then like from our testing, it's getting more accurate than what general ChatGPT does because it uses obviously Reddit and all that kind of stuff. This is just very much focused. So that's interesting. But, now that I'm on the other side and I'm providing a GPT, I'm telling everyone, you got to take everything with a bag of salt because it is, AI can definitely make mistakes. And, as a tutor, you're probably seeing the other side of it where they're coming with these preconceptions and ideas that they've learned from AI, which are false. And you need to be able to pick up on that and validate that. The thing I want to ask about next, Rima, is so the people you said were leaving expectations. Okay, expectations were not met. What is on the flip side the most rewarding thing about what you do?
I think, sometimes you have the students and they're like, thank you so much for teaching me that. I understand it so much better. Just little comments like that, for me, is so incredibly powerful. I think when a student asks to be specifically with yourself, I think that's really nice, really rewarding. If you come out of your way to request me as a tutor. And for me, it's just so nice. And now I think a lot of the students I've taught are now in the big bad world now, which is great. And so a lot of them are now colleagues, and now seeing that relationship shift from student and teacher to now colleague is it's really, really nice. And I just think it's nice that they had such a positive experience. Well, so they told me with myself that, that they don't steer me or they don't feel like, this person made me cry or whatever, It's nice that we've had such a positive relationship because you never know, these could be our future principals and things like that. A lot of them have done quite well. It's still pretty early days. I've only been doing it, and that's my 6th day doing it. But yeah, a lot of them are doing pretty well for themselves, and it's nice to hear, oh, they're doing that now. They wanted to do this and they've gone that way, so it's fantastic. So, I think that it's so rewarding. I think sometimes even that they had a difficult case and they're like, oh, I'm really, really stressed out, but thank you for helping me through that case. I think that means a lot.
I wish you were my tutor at school. Honestly, you're obviously very
I wish you were
approachable.
mine. I don't think they can afford your pay packet.
The whole concept being just genuinely nice and wanting the best. It's the worst thing ever. Like that whole old school mentality of let's break these students down, let's make them cry. Like some institutions are sort of connected to that back in the day, and you'd hear about that. But I don't know. I always think come with compassion, kindness. So I definitely get those vibes from you. Last few questions: how do you balance like clinical work, teaching, personal life without burning out?
Yeah. So I think what's great about teaching, especially if you do it part time, is that sometimes teaching can get a little bit much. It's very busy, and you've got loads of cases, but then you've always got your practice, which is a completely different patient. So I love that balance. And then the same goes for practice. Generally, it'll be the other way around. Practice will get a little bit more stressful. You'll get loads of patients who, they're coming back or they need X, Y, and Z. And sometimes practice can get a little bit much, as we all know. You get tired, burnt out, you're saying, patients that you don't always want to do. Teaching can be almost like a release from that because you're still doing your job, but you're just doing something different. And I love that. I think the balance is just fantastic. You just don't get sick of one. Sorry to put it as crudely as that. And I just think that's fantastic. It just means that I'm always looking forward to going to whichever place I'm at, whether it's practice or whether it's in hospitals. I think recognizing burnout is really, really good. And I love something you said on one of your podcasts where it's like, book the next holiday. Always have a holiday book. You're really trying to do that. I honestly could not agree with you more on that. So yeah, just making time, making sure we're proactive at, booking time off, whether it's a holiday or not, just always having that in the diary because you just don't know when you're burnt out. You don't want to be begging for leave or whatever. But another one of the perks with teaching is paid annual leave as well, which is really good because you don't get that in general practice. So paid annual leave is good.
Well, on that topic, paid annual leave, I actually forgot that existed, so that's amazing.
Yeah,
Paid annual leave is
exactly.
good, but overall, I remember like being a fourth year student, and there were these GDPs in Sheffield who would come and teach a day a week, like you do, right? And said, come and teach, and then naturally we'd ask about, what's it like teaching here compared to being an associate in terms of pay and stuff. And then what the answer they give is they smile and say, "Mate, this is charity work." That's literally what they said. Like that's their words. Okay, so like, do you feel it's an insultingly low amount, or do you feel it's enough to like
I
maybe I don't know if
love
the rating
that.
gone up or whatever, but that's the words they used.
Do you know what, Jazz? We hear that thing, we do, and it all depends that we will have dentists who do implants, which of course, proportionally, it's nowhere near. Um, but I think there are a lot of perks. There's paid annual leave. You do get a few kind of like Kings is quite great in that, you get access to discounts, you get access to things like, for example, nursery fees. They cover things like that as well. So there's a lot of perks that, we don't talk about. This is specific to schools, obviously, but there is
But
other.
you're not going to do it for the money, right? You're not going to go into the dental school tutoring for the money. You do it because you
Yeah,
want to, but it's not
exactly.
like it's not like it's a total like, oh, this is you're not getting paid anything at all. You get the annual leave, and just it's a nice break in the week, I guess.
Yeah, I think also, so Jazz, I don't know about you, but I'm very quiet around Christmas. I'm very quiet around Easter and my
Mm,
practice. People just don't want to
mm,
come in. And that's absolutely fine. But so it's nice to have that stable income coming in. Every
mm.
month you get the same amount. Whereas as practice you get variable amounts. You might have a
Yeah,
really
well
busy
said.
month, you might have a really quiet month. And naturally, where do we pay our GDP fees? We're to pay it yearly. It's in December, where a lot of us are quiet. We pay our tax in January. Again, sometimes it's a little bit quiet as well. So it's nice to have that stable income coming in every month. Um, don't get me wrong, obviously you don't want it to be a massive part because obviously, you want to be a bit profitable as well. But it's just nice to have that. But yeah, it also depends on what other specialities and things you have. But yeah, it's good. I'm not gonna lie to you. It's okay. But yeah, you could earn more.
Yeah, but that's it. You can earn more in practice, but you don't. You do it to break up the week from practice, and what you get paid in, the student success and the gratification and the experience is why you do it for. And what a pleasure it is to be able to teach and guide the next generation. So, hats off to you, Rima. Any final words for the colleagues listening who clicked on this episode thinking, "Oh, I fancy a gander at potentially going into dental education"? Any last bits of advice for them?
I just think if you're even considering it, you probably are indirectly teaching anyway. You might have an associate, might have a foundation trainee in your practice, and you might already be providing them with some advice or support and things like that. And if you actually enjoy doing that, and if you think you're good at it, then why not just make it, a 1 day, 2 day a week job? Especially if you're finding practice isn't 100% what you want to do. It's just nice. It breaks up the week. It's fun. You go out with your colleagues, you have lunch together. It's just really nice. Honestly, it's just a nice
That's
one
the
day
cool
out.
thing about the concept of having lunch, which obviously doesn't exist when you're an associate or you're in
Exactly.
practice. There's no such thing as having a lunch. You're always on the phone to a lab or you're doing notes or whatever. But yeah,
100%.
having a lunch I'm sold just by that.
And it's in central London, we've got lovely views, it's so great. It's just a fun day out, honestly, it really is. And you have a lot of banter and jokes with the students. It's really fun. So if anyone's even considering it, I'd say go for it. What's the worst that's going to happen? Really don't like it, but if you're really enjoying it in practice, I'm sure you will enjoy it in the hospital too.
Amazing, Rima. Thank you so much. Is there any way that some people can reach out to you, ask you questions, or send some thank yous, or wherever they want to do?
Probably Instagram is the best thing. I actually had to check my Instagram. How can we remember it? So it's Rena Sagia. I think it is actually, yeah. So you're welcome to.
Amazing. Well, Rima, thanks so much for your time and explaining, a bit about the rewarding nature, the challenges, expectations. I think it's important to set the right expectations, and also your journey. Appreciate you coming on today.
No, thank you so much for having me on. No, I really appreciate it. Thank you.
Well, there we have it. Thank you so much for listening to me and Rima all the way to the end. So what do you think? Do you think you'd be a good fit for dental education? Is this something that potentially excites you? And does it warrant you to do a bit of research and contact, and perhaps your next move is do some research? Is there a demand for a dental school near you? Could you maybe start a study club and share your ideas there to start with? Do you want to start sharing some ideas on social media? Maybe you just want to educate the public. That has its own challenges, but the scale is huge there. So if this idea of teaching really resonates with you, the world is your oyster. Now, this episode is eligible for CE and CPD credits. We are a PACE-approved education provider. If you're watching on the Protrusive Guidance Network and you're on the premium version, please scroll down and answer the quiz. If you get 80%, our CPD Queen Marie will send you your certificate. She also sends you quarterly certificates and an annual summary. And every month we have a little fun leaderboard to see who's done the most CPD that month. That's all on our network, Protrusive Guidance, the home of the nicest and geekiest dentists around the world. Check it out on www.protrusive.app. And I want to thank my guest Rima once again for doing a wonderful job of sharing her own story, her own background, and her experiences in teaching. In the next episode, we're going back to clinical, and it's about consent in orthodontics. So I'll catch you same time, same place next week. Bye for now.